Welcome to the Memorial Total Joint Replacement class. The purpose of this class is to allow you to set expectations for before surgery, your hospital experience, after surgery, and to ease anxiety about your procedure and provide you with educational materials for continued reference. Research has shown that having a positive attitude enhances the patient's overall experience and leads to less pain after surgery and a faster recovery process. Feeling well prepared for surgery will help foster a sense of control and confidence. Patients and caregivers who have a thorough understanding of what to expect before and after surgery, and most importantly, know who to call with questions, will have less anxiety in the days and weeks surrounding the event. Important times and information to know. You will be called with your arrival time for your surgery by 6 p.m. the day before surgery. If your surgery is on a Monday, you will be called Friday by 6 p.m. You are allowed to have visitors come with you on your surgery date. If they come to visit the next day, they will need to come through the main entrance of the hospital, not through the day surgery entrance like they did the day prior. You may also have one visitor who can stay the night at your bedside. If a visitor spends the night, we ask that the visitor be over the age of 18 and not have been ill within the last 14 days. Anticipate going home the day after surgery. Our goal is to discharge between 10:30 and 11:30 a.m. If you are waiting on a ride or a piece of equipment to be delivered, you may go to the Discharge Central Lounge to wait on these items. At Memorial Health, above all else, we are committed to the care and improvement of human life. Total hip replacement, also known as hip arthroplasty, is a common orthopedic procedure, and as the population ages, it is expected to become even more common. Replacing the hip joint with an implant or prosthesis relieves pain and improves mobility, enabling you to resume your normal, everyday activities. During hip replacement surgery, the damaged bone is cut and removed along with some soft tissues. The surgeon removes the damaged femoral head and inserts a metal stem into the hollow center of the femur. The surgeon then places a metal or ceramic ball on the upper part of the stem. This ball replaces the damaged femoral head that was removed. The surgeon removes the damaged cartilage surface of the socket, or acetabulum, and replaces it with a metal socket. The surgeon may use screws or cement to hold the socket in place. The surgeon will then insert a plastic, ceramic, or metal spacer between the new ball and the socket to allow for a smooth gliding surface. In the past decade, the direct anterior approach has become popular because it requires less disruption of the underlying tissue and muscle. In this approach, the surgeon makes the incision on the front of the hip. Less cutting of the muscle is necessary, and recovery has been reported to be much faster. Total knee replacement, also called knee arthroplasty, is a common orthopedic procedure that is used to replace the damaged or worn surfaces of the knee. Replacing these surfaces with an implant or prosthesis will relieve pain and increase mobility, allowing you to return to your normal everyday activities. To perform a knee replacement, the surgeon makes a vertical incision over the front of the knee to expose the joint. The surgeon will then prepare the bone. The damaged cartilage surfaces at the end of the femur and tibia are removed along with a small amount of underlying bone. Secondly, positioning of the metal implants. The removed cartilage and bone is replaced with metal components that recreate the surface of the joint. Third, resurface the patella. The undersurface of the patella or kneecap is cut and resurfaced. Some surgeons do not resurface the patella. It all depends on the case. Lastly, insert a spacer. A plastic spacer is inserted between the metal components to create a smooth, gliding surface. Here at Memorial, our surgeons utilize a proven research-based surgery approach known as Enhanced Surgical Recovery, or ESR. This protocol has shown to optimize patient outcomes as well as optimize patient experiences. The goal for you as the patient is to dream, or to drink, eat, and mobilize as quickly as possible after surgery. Everyone should be getting up to walk the day of surgery. Following the ESR protocol helps to decrease risk of surgical complications, decrease stress on your body, and allow for a speedy return of bowel function. Potential benefits of ESR for the patients include eating sooner after surgery, shortening the hospital stay, nausea reduction, faster recovery, and appropriate management of pain. Preoperatively, patient interventions include understanding of pain management and mobility, no food after midnight prior to surgery. You may drink water up to 2 hours prior to your surgery arrival time. Postoperatively, move, stand, and walk as much as possible after surgery with assistance as needed. We use a multimodal pain analgesic regimen, which means a combination of medications will be administered to adequately manage your pain without solely relying on opioids. Be sure to communicate your pain level using the 0 to 10 pain scale. Before surgery, there are a few things to keep in mind in order to help prepare you for recovery. First, you will need a designated caregiver who will be able to assist you throughout your recovery. You will not be driving for 6 to 8 weeks and will need someone to help with transportation to appointments, such as your outpatient physical therapy appointments and your post-op follow-up appointment with your surgeon. You will not be able to drive until you are cleared by your surgeon to do so, and not until you are off all pain medications. You should also pack an overnight bag in case your surgeon would like for you to spend the night for observation. Things to consider packing include a CPAP machine. If you use a CPAP machine at night, you will want to make sure to bring this in with you the morning of your surgery. You do not need to bring the water for the machine, as we will have plenty available. Bring the things that help you with day-to-day life, such as hearing aids, contacts, glasses, and dentures, but also be sure to bring a case for these items, as they will not be allowed into the operating room. You may change into your own clothes after surgery, and we encourage you to do so. Feel free to bring a change of clothes or pajamas. We recommend to wear loose-fitting, comfortable shorts, pants, or dresses. Also, please be sure to bring insurance cards, photo IDs, and a form of payment if needed. Lastly, you will want to have a walker available for after surgery. You do not need to bring your walker into the hospital with you, as we will have walkers available in each of our private patient rooms and PACU setting. Physical therapy will provide a walker for you to utilize when working with you. You will, however, want to be sure to leave your walker in the trunk of your car to help you from the car into your home after surgery. After surgery, you should avoid crowds for a few days just to allow your body's immune system to rebound. This includes avoiding places such as grocery stores, restaurants, churches, clubs, or any other crowded areas. Finally, you will want to avoid alcohol, smoking, and secondhand smoke after your surgery. It does not matter what type of surgery you have, there is always a risk for potential complications. Your surgeon and Memorial Health staff exercise extensive safety precautions to minimize your risk for complications associated with your surgery. While we see very few complications after an elective total joint surgery, we will take time to review the possible complications seen on this slide in the next few slides. We're going to shift our focus to interventions and things that we can do to lower our risk of complications. Please be sure to discuss with your surgeon any areas of concern. The first possible complication we will talk about is blood clots. After joint replacement surgery, it is possible to develop a blood clot in the veins of the lower leg. There are several interventions to help reduce the risk of blood clots. First, you will be provided with a pair of compression stockings or TED hose while you are here in the hospital. If you are having a total knee replacement, you will only have one of the TED hose applied to your non-operative leg. You will need to take the other TED hose with you to your first physical therapy appointment, and they will assist you with application to your other leg. If you are having a total hip replacement, you will have TED hose applied to both legs. Regardless of whether you are having a total hip replacement or a total knee replacement, you will need to wear your TED hose until your post-operative follow-up appointment with your surgeon unless directed otherwise. You may take the TED hose off to do personal hygiene, such as shower, but they must be reapplied. A second form of compression that will be used are SCDs, or sequential compression devices. These are also used to improve blood flow. SCDs will only be worn while you are in the hospital bed. You will not take these home. After surgery, your surgeon will also prescribe you a blood thinner that you will continue for 2 to 3 weeks at home after surgery. Aspirin is commonly prescribed post-op for blood thinning, not for pain relief. Your surgeon will review your current medications and determine what blood thinning medication, if any, is appropriate for you. A great way to reduce the risk of a blood clot is to walk early and often after surgery. Walking helps increase circulation, decrease the likelihood of blood clots, and makes you more comfortable with your new joint. While you are in the hospital, our staff will assist you when walking. At home, you are going to want to walk every 1 to 2 hours during the day while you are awake. Slowly increase your distance as tolerated. There is also an exercise that can be done to help increase blood flow, and those are called ankle pumps. Whether you are a total hip patient or a total knee patient, everyone should complete 10 ankle pumps every hour while awake. In order to do your ankle pumps, you may either choose to sit down or lay down with support behind your legs. You will then push your toes down and hold for 2 seconds, similar to pushing down a gas pedal in a car. And then bring your toes towards your nose and hold for 2 seconds. You feel the contraction in your calf during the exercise. Each up and down motion is considered 1 ankle pump, and again, you should be doing your ankle pumps 10 times per hour after surgery while you're awake. After surgery, you will also be provided with an incentive spirometer with instructions for use. Deep breathing is very important after surgery as it expands the lungs, helps circulation, and helps prevent post-operative respiratory infections like pneumonia. It is common to have pain after surgery, but this will decrease over the first few days and gradually resolve. Managing your pain and discomfort is one of our highest priorities here at Memorial Health. Pain medication is ordered in the hospital to be given as needed. Advise your nurse if your pain level is increasing. Please review the 0 to 10 pain scale on this slide in order to help ensure effective communication with your nursing team. Also, please be sure to avoid overstating your pain level, as we want to be sure we are not over-treating or under-treating your pain. It is important to ensure your pain is also managed at home. Pain management helps improve mobility and enables you to participate in your physical therapy and begin the rehabilitation process as quickly as possible. There are several interventions to assist with pain management. 1. Taking pain medication as prescribed. Please note, pain medication should never be taken with an empty stomach. It is recommended to have at least 5 bites of food to coat your stomach and avoid any GI upset such as nausea or vomiting. 2. Ice therapy. Icing helps to reduce swelling, which in turn helps reduce pain. At a minimum, aim to ice at least 2 times per day. Please remember to place a barrier between your skin and ice source to prevent burns. For our total hip patients, you may ice with an ice bag, gel pad, or even a bag of frozen peas. Total hip replacements will follow the 20-20 rule when icing, meaning you will keep the ice on for 20 minutes and take at least a 20-minute break with the ice before beginning again. For total knee replacements, you will be icing with a polar care that will be provided in the hospital for you after surgery. This will be yours to take home and keep, so there is no need to return it. We will review the cooler on the next slide. This integrated cold and compression cooler will help reduce post-operative swelling and provide both gravity and motorized cold and compression therapy for flexibility of care. Using the cooler, total knee replacements will follow the 45-45 rule when icing, meaning you will keep the knee pad on for 45 minutes and take at least a 45-minute break with the knee pad off. Please do not wear your puller while sleeping. Lastly, progressive relaxation and music. Some studies suggest that olfactory stimulation related to aromatherapy can result in immediate reduction of pain, as well as changing physiological parameters such as pulse, blood pressure, skin temperature, and brain activity. In addition to a decrease in pain, research shows that pet therapy can also help improve mood, reduce anxiety, as well as agitation. Please remember, changing positions frequently will keep you comfortable in the hospital as well as lessen your pain at home. And again, exercise and walking are very important after a total joint replacement surgery. This will help to increase circulation, increase your energy levels, and reduce the risk of a DVT or blood clot. This integrated cold and compression cooler will be provided to and used only by total knee replacement patients. This helps to reduce post-operative swelling and provides both gravity and motorized cold and compression therapy for flexibility of care. Again, please remember patients will follow the 45-45 rule when icing, meaning you will keep the knee pad on for 45 minutes and take at least a 45-minute break with the knee pad off. Again, please do not wear your puller while sleeping at home. We will provide you with a demonstration and instructions for use at home prior to discharge. One small tip: utilize frozen water bottles rather than ice in your cooler. This integrated cold and compression cooler will hold 4 regular-sized water bottles and 5 of the smaller 8-ounce bottles. Recovery speed and effectiveness after surgery are largely determined by what we eat. Not only does our body need more calories to recover, but surgery also causes a stress reaction in the body that elevates the metabolism and increases our need for calories. If we don't fuel our recovery with the proper food, complications are more likely to arise. If you are on a doctor-prescribed diet, such as diabetes, cardiac, renal, bariatric, etc., always inform your primary doctor before making changes to a special diet. While the recommended foods help your body recover after orthopedic surgery, their positive effects can be canceled out by other foods. Please make sure to avoid caffeine, alcohol, excessive sugar, and salt, as they can all slow bone healing by depleting your body of nutrients. Unless advised otherwise by your physician, try to get your nutrients from food rather than supplements, because food helps the body absorb them better. There are a few things you can start doing today to improve health and help with bowel management after surgery. First, eat plenty of fresh fruits and vegetables. You will want to aim for 5 to 7 servings a day. 2, increase the fiber in your diet with things like whole grain cereals and breads, and again, plenty of fruits and vegetables. Last, please be sure to drink at least 6 to 8 8-ounce glasses of water a day. Drinking plenty of fluid along with movement can help avoid constipation after surgery. Your surgeon and anesthesiologist will discuss the best route of anesthesia for your surgery. 2 options generally include general anesthesia and spinal anesthesia. With general anesthesia, you are put to sleep and a machine is used to help you breathe during surgery. With spinal anesthesia, you are numbed from the waist down and your breathing will still be normal. You will be given medication that allows you to sleep during surgery, and you will not be aware of your surroundings. Spinal anesthesia can decrease the chance of nausea and vomiting after surgery. Infection is the last possible complication we will discuss today. First, let's review the signs and symptoms of infection. A persistent high fever of 101 degrees or more that is sustained for 4 hours or more, increased swelling or tenderness of the joint wound, increased drainage. Drainage should also never be yellow or have a foul odor, as well as excessive redness. Anytime you have any of these signs, please notify your surgeon immediately. There are a few things that we can do to reduce the risk of infection prior to surgery. First, you will be asked to clean your skin prior to coming in for surgery. You will do this either with antibacterial soap or CHG cleansing cloths. If your surgeon would like for you to use the CHG cleansing cloths, they will be provided at the time of your pre-surgery testing appointment, along with instructions for use. A second thing that will be done to lower the risk of infection is the use of antibiotics, which will be given through your IV prior to the start of your surgery. At home, you and your caregivers also play an important role in preventing infection. Be sure to keep your incision clean, dry, and covered, and always follow your surgeon's instructions for incision care and dressing changes. Anytime you change your dressing at home or are touching near your incision, please be sure to wash your hands. The CDC says to wash your hands for at least 20 seconds with soap and water. An easy way to remember this is to sing the happy birthday song while you're washing your hands, as this is about 20 seconds. What to expect the day of surgery. One of our staff members will call you by 6 p.m. the day before to let you know what time to arrive for your surgery. On the day of surgery, again, please present to our day surgery building. Upon arrival, you will check in and meet with one of our registration team members. Once registration is complete, you will be taken back to the pre-anesthesia area, also known as pre-op. Here, our staff will assist you in preparing for surgery by having you change into your surgical gown, starting your IV, and possibly cleaning and/or shaving the surgical site. In pre-anesthesia, you will also meet with your anesthesia provider, your surgeon, and your operating room nurse. The average length of surgery for both total hip and total knee replacements is 1 to 2 hours. During surgery, your visitors will wait in the main lobby. Once surgery has been completed, the physician will discuss outcomes with your family. When surgery is complete, you will spend about 3 hours in the recovery area. Sometimes a little less, sometimes a little more, as everyone is unique. This allows you time to wake up from anesthesia, as well as for staff to be able to manage any immediate symptoms that you may be experiencing. If you are being discharged the same day as your surgery, physical therapy will come to help you walk prior to discharge. For those who are spending the night, from the recovery area, you will be transferred to our dedicated total joint replacement unit. Here, physical therapy will assist you with walking in addition to staff members on the unit. Some members of your team will include your nurse, patient care technicians, physical therapy, occupational therapy, as well as case management. You will need to have a rolling walker to use after surgery. Patients should receive a call prior to surgery to ensure that they have a walker, and if not, the office will coordinate with insurance to obtain the walker prior to surgery. If you do not receive a call from your surgeon's office about a week out from surgery, please call the office to let them know that you will need a walker ordered. For the day of surgery, bring your walker to the hospital, but please leave it in the trunk of your car. Use our walker while inpatient and have your personal walker available for use from the car to your home upon discharge. If your surgeon would like for you to do outpatient physical therapy after surgery, your surgeon's office will schedule and arrange this with you. At the time of discharge, you will receive a discharge packet that will contain information such as activity restrictions, incision care, dressing instructions, new prescriptions, as well as the information above on this slide. If after discharge you are having trouble breathing, chest pain, you are coughing up blood, or have chest pain when you cough, please be sure to seek emergency care. Additionally, if you fall and think you have injured your new total joint, or your surgery leg becomes cool to the touch, is turning pale or blue, or the whole leg becomes numb and tingly, you will want to go ahead and call 911. These can indicate an emergency, and you should get to the hospital as soon as possible. We will notify your surgeon upon your arrival to the hospital. If you need assistance for a non-emergent issue, you may always call your surgeon's office. Each surgeon's office does have an after-hours answering service. Thank you for choosing to have your surgery with us. You will receive a follow-up phone call within 4 days after discharge. This phone call is made to check in with all of our total joint patients and to continue their education process regarding the status of your recovery, things such as pain, therapy, your incision site, smoking cessation, and nutrition, to evaluate any issues or problems after discharge, such as constipation, wound care, or pain, and to receive any feedback from your hospital experience. At Memorial Health, above all else, we are committed to the care and improvement of human life.